How about people that have like panic attacks, those anxiety? Would they be good for EMDR, or is that not?
People who have panic attacks and anxiety would be perfect for EMDR in a lot of ways. If the panic and the anxiety is a result of a traumatic experience or has been the result of a trauma, EMDR can help tremendously. What we know about the brain is there are certain areas of the brain that become hyperactive as a result of a trauma, and so panic and anxiety is sometimes the result of that. And sometimes people don't remember a traumatic experience until they're actually in the therapist office saying, I'm here because I'm having anxiety attacks. And in the discovery of what's gone on, we find out that there actually is a trauma that's connected to. And so it's not uncommon for people to come in with just anxiety or panic. And EMDR really does help to reduce that. Now, it's important to understand that if there is something physiologically wrong with the individual, if the individual has a thyroid disorder per se, or if they have something that has gone on naturally occurring within their body where they're normally prone to anxiety, EMDR does not fix or heal a physiological problem. It works on issues that have come up, and the brain and the body have developed an inappropriate reaction to certain things, and so it doesn't cure, can't cure ADHD, but EMDR can certainly help for somebody who has ADHD and has been exposed to experiences where people have suggested that they weren't trying hard enough, that they were being lazy. And we know that when you have a lifetime of hearing that you weren't trying hard enough and that you're lazy, then sometimes that becomes a self-fulfilling prophecy, or can become just how you view yourself, and it interferes with your ability to move on and become the best that you can be.
Okay, so it helps with anxiety, panic, and even things like ADHD. It won't clear that out, but it would help kind of lower the anxiety level or self-esteem issues?
Self-esteem issues, yes, absolutely.
Okay. How about depression? Any help with that?
EMDR can help with depression. EMDR, again, it's not going to heal the depression if the depression is organically based. But what EMDR can do is help an individual to deal with the result of that depression. Has often meant that people think that they're not trying hard enough, or sometimes people lose jobs. So again, their self-esteem, how they view themselves is affected negatively. And what EMDR can do with the depression is to help the person view themselves in a more positive light, and view themselves actually not in a more positive light unless it's genuinely true, but help them to see themselves for what is really going on and not to blame themselves. If you have an organic depression, you tend to believe that I'm just not trying hard enough, and I've got this problem and it's me. And EMDR can help change that. Now, if the depression is based on a circumstance that's happened, then certainly EMDR can clear that out. It can go and heal that a situation that's occurred. So a depression that is the result of a job loss, then EMDR can help that.
So depression that you can be a result of a job loss, or maybe a death, or kids going away to college.
Right, empty nesters.
Pay for kids going away to college.
You're paying for the kids.
So any of that, it can help with those kind of things.
Right.
Okay, good.